What are the symptoms of Hashimoto's thyroiditis? I'm Dr. Childs, and today we're going to be talking about just that. Hashimoto's thyroiditis is a disease that causes low thyroid. And so most of the symptoms of Hashimoto's overlap with the symptoms of hypothyroidism. That includes things like weight gain, hair loss, fatigue, menstrual irregularities, depression, brain fog, constipation, dry skin. All right, these are all the symptoms that show you that your thyroid is not functioning optimally. But things can also get a little interesting if you have Hashimoto's, because Hashimoto's doesn't always cause low thyroid. In fact, some patients who have Hashimoto's can experience bouts of hyperthyroidism, meaning sometimes their thyroid will be high and sometimes their thyroid will be low. Now, ultimately, you all end up in the same place, which is low thyroid, but sometimes it can fluctuate, and that's important for you to understand if you have this problem. And finally, because Hashimoto's thyroiditis is an autoimmune disease, you also may experience symptoms associated with your immune system. Things like getting sick more frequently, experiencing food intolerances, having gut problems, maybe you have other autoimmune diseases, and finally you might have sort of weird symptoms like rashes and things like that. These are symptoms primarily associated with your immune system and can be stacked on top of the other thyroid symptoms that I just mentioned previously. Here's the tricky part. If you have these symptoms, you must get the right test. That means you need to be getting your thyroid antibodies, both TPO antibodies and thyroglobulin antibodies. If you have these markers and they're positive, that's a very strong sign you have Hashimoto's thyroiditis.